We don't really know what the signs and symptoms of stress are. We actually have just normalized those things because we were taught that these things are normal by our parents, by society. Like, toughen up.
Like, don't go, oh my gosh, I have to go to get an MRI or I have to have a neck surgery. Start with just basic exercise, movement, and then you can kind of build up from there.
The energy that we observe will eventually be the energy that we absorb. And so we have to be really mindful about what we're seeing, what we're listening to. All right. Welcome to the AlignUs Podcast. I'm your host, Dr. Nikhil Sharma, and I'm so grateful to have you all here with us today. In today's topic, we're going to be delving into the world of CNS regulation and seeing how getting ourselves being balanced can help us prevent from getting any sort of physical debility. Joining us today is Dr. Liana, who is the jaw pain doc. Is that right?
Yeah.
Yeah, I love it. We were just talking about that. What a great name. And she owns her own, physical therapy company called Revive Therapy. Welcome to the show, and we're so grateful to have you here with us today.
Thank you so much for having me. Really honored.
Yeah, well, when we kind of first, struck up a conversation, there was a lot of, alignment, especially when it came to how we want to be able to handle our patient population and realizing that stress is really at the core of a lot of individuals' physical debility. I know from working in the hospital for about 12 or 13 years, the patient population that I had really had a lot of stress that was causing them to have and make poor decisions when it came to their own health. And especially my patient population was like liver failure. So a lot of them either came in due to the fact that they had alcohol liver disease or they had morbid obesity and fatty liver disease. But at the underlying cause of that is addiction. And that is due to the fact that they're in stress all the time. They never spend any time to re-regulate themselves or help them manage their stress in order to prevent them from choosing things like alcohol, choosing things like food to, exacerbate their issues, and I think that's something that's happening more and more. And that's likely due to the fact that we weren't really considered, or we didn't really understand how stress builds up in our body. We don't really know what the signs and symptoms of stress are. We actually have just normalized those things because we were taught that these things are normal by our parents, by society. Like, toughen up, like, oh, you're feeling tired? Tired is for like wussies. You need to be able to get stronger. Especially, I remember being in residency, that sleep wasn't even an option. It was like we would have 24-hour call, 30-hour calls. And, you would become really dysregulated, I would say. And, what you thought was normal was actually stress that was building up. It's just that I didn't realize that's what it was until I crashed and burned.
Yeah, I have a similar story too, where it was like I wasn't recognizing the signs of stress. It was wreaking havoc on my body. And it took a pretty significant wake-up call for me to honestly get a hold of that. And I was honestly just talking about this on my Instagram stories the other day about how, especially as moms, like I'm a mom, I don't know if you are a parent or not, but moms, we tend to just take on all of these things and do all of these things for our kids, our families, and this and that we don't really pay attention to what's going on with our bodies and how that's really truly affecting us. And we do need to take a minute and take care of ourselves.
And, one of the ways stress can show up in our lives is typically, in physical symptoms. And typically where I've noticed where they show up the most is within the head, the neck, and the jaw areas, right? And so it's funny how, that happens, but there's a physiological reason for that, And so a lot of people don't understand, how the CNS and the nervous system, functions. And we have we have two different types of, autonomic nervous system. We have like the fight or flight, which is like the sympathetic nervous system. And then we have the rest and digest, which is the parasympathetic nervous system. So it's really important for individuals to understand these two parts of our nervous system. And so with the sympathetic nervous system, which is like fight or flight, so just imagine when, like there's a fire in your house and you wake up in the morning and you smell smoke. you need to have that sympathetic system kicking in and, getting you up, making moves out of the house as fast as you possibly can. And what happens? Your heart rate starts going up. The blood flow starts going to the main organs of the body, which is your brain, your heart, and your lungs. So oftentimes, when people are in stressful situations, they'll notice themselves having headaches. They'll notice themselves feeling pain in their jaw, issues with stiffness in their neck. And then, their hearts are palpating, and then that fight or flight, will last typically, for several hours, but then it wears off. The problem is that if you have multiple stresses throughout your entire life, your nervous system becomes dysregulated. And so situations where it's not an emergent situation, like it's not necessarily your house is on fire or an intruder has come into your door and you're in survival mode, something like an email comes to you and you're not happy with what the email is saying, or your friend said something to you and you're turned off by that. That same fight or flight system will start kicking in, and then you'll start noticing yourself having headaches, having neck pain, having chest pain, having GI issues, because when the sympathetic system is going off, it's taking away blood from your stomach. And again, it is specifically targeting your most vital organs, which is your brain, your heart, and your lungs. So that's why there's this whole big thing about gut health these days, correct? And it's all related to stress, because when you're in that higher stress level mode, you're having less blood flow to the gut. That means your food is not being digested properly. You're having more bloating. You're having IBS, which is irritable bowel syndrome. So sometimes you have constipation, sometimes you have diarrhea. And then that can affect our mood because our gut has like serotonin in there. And so it's considered our second brain. So understanding stress, understanding just at least a little bit about the nervous system can really help you have a better outcome when it comes to your physical health.
100%. 100%. I see it every day.
So when you're seeing patients and with this pain, with headaches, with neck pain, with jaw pain, how are you assessing them? And then what are some of the steps that you're doing to really help them with the actual physical debility that they have come in with? Yeah.
So one of the biggest things that I do is listen. I truly believe that a patient is going to tell you everything you need to know in a thorough history intake. Ask questions, be interested, and just genuinely listen. You don't need to make up anything in your head. They're going to go ahead and tell you everything that you need to know, and you just need to listen. So we do that. I do a lot of listening, a lot of them just telling me what's going on. And honestly, from that, I can tell, they're telling me, hey, I don't have good bowel movements. I'm not sleeping well. And I can kind of go down that road of, hey, they probably have some nervous system dysregulation. But we're also looking at some of the physical signs. How many headaches are they having every week? Do they have neck pain? They'll even say, oh, when I get stressed, I just feel it all in my, my traps, in my neck, and my jaw. And there I'm like, okay, that's what we're going to work on too. We do some breathing assessments. So a lot of times when the nervous system becomes dysregulated, people aren't breathing well, right? Even though the lungs are getting all of this blood flow, like you're saying, they're not taking deep breaths. Their respiratory rate is super fast, right? Similar to like if you were to be running from that fire, right? So we are working on getting that diaphragm to activate, getting a deeper breath, not necessarily a bigger breath, but a deeper breath, a more like a slower breath rate, a regulatory breath rate. I'm working on getting them to sleep better. So a lot of times these people aren't even sleeping well. And maybe that's because the nervous system's dysregulated, or maybe that's because there is something that's being missed. A lot of times people with jaw pain, their airways are not well. Like ENTs are dismissing them for deviated septums and they can't breathe through their nose, right? So if we can't breathe through our nose, that's like a primary way for our diaphragms to activate. When we breathe in through the nose, so many wonderful things happen to regulate our nervous system, right? We get nitric oxide, which gets the oxygen deeper into our, circulatory system, deeper into our lungs to help regulate the nervous system from like a physical aspect. But if we're breathing through our mouths, if we have a deviated septum or enlarged turbinates or, whatever else is going on in there, we have that poor cycle, right? That dysregulated cycle. So a lot of times we're working on that, getting them good quality sleep, on top of what's physically happening to the muscles. That when they do clench, they are, becoming fatigued. They do have, soft tissue restrictions and pain there. So working from both a physical pain aspect, but also from a deeper rooted, like, hey, we got to regulate your nervous system a bit more.
Love that. And two of the things that really stuck out to me was, breathing. And getting them under and understanding how good breathing techniques can really help regulate our CNS. And you obviously mentioned some of the great factors when you're inhaling nitrous oxide. It's helping blood flow go deeper into the lungs. But also, you really want to also focus on breathing out more carbon dioxide, right? That's one of the main, elements that we breathe in. But then it's an acid. So if we have too much of that CO2 in our system, it will cause us to have more anxiety. And so when you really want to work on your breath work, one of the main goals should be to breathe out more than you're breathing in, and that's actually helping the carbon dioxide get out of your system. And you'll notice yourself getting in more of a calming state of being. The other thing you mentioned was sleep. And with that, we're talking about biorhythms, and that's listening to your body. I love how you mentioned like listening. The problem is that we don't really do a good job at listening. We don't really listen to others really well. We tend to not listen to our own selves, what our body is telling us. But biorhythms are so big. And so it's like when your body's tired, you should sleep. When you're feeling hungry, you should eat. When you're feeling full, you should stop eating. Right? These are some of the things that like our body is telling us, and we just need to listen a little bit. And sleep is such a big deal when it comes to central nervous system regulation. I've noticed myself when I was working in the hospital and I was on call late at night, and I would be on like a 1 week on, 1 week off service. But that 1 week on, I was in a constant fight or flight mode. I was feeling stressed. I felt like my pager was going off. I wasn't sleeping well. And then the week after, I'm just spending it trying to recover on sleep. But my circadian rhythm was so dysregulated, it causes you to be in a chronic, constant state of fight or flight. And that means you're having cortisol levels that are increased. And what people don't realize is that when you're in stress, it actually sets off an immune response in your body. So similar to like when an infection comes into your body, your stress levels will cause your immune system to go off. So that means all these inflammatory markers that are set off to go fight an infection, well, they're not finding that infection, but they're trying to figure where it's coming from. So when they don't find it, they go and sit on different organs, like your brain. You get headaches, like your heart. Your heart starts speeding up, like your lungs. You start breathing faster. And that's all from a stress response. And so over time, imagine all these inflammatory markers building up on different organ pieces. That's going to cause different things, like cancers, like autoimmune diseases, right? So people, now hopefully are becoming a little more aware of the importance of recognizing when stress is going on in your body, and then like the importance of having that toolkit ready to go. Like, hey, all right, I've noticed myself, like something has just happened, and now I'm realizing I have a headache. My heart feels something. I'm having some chest pain. Like, I need to do something about this. And usually doing something about it, oftentimes for most people, they get really distracted. They don't like sitting in that pain. It's very uncomfortable, especially if it's something that's really causing your heart rate to go up. You want to get away from that pain as quick as possible. And so oftentimes people will distract themselves with social media. They'll start drinking. They'll start doing drugs. They'll do gambling, some sort of distraction, whatever it is, behavioral or alcohol or drug. And that just... all that does is just make that pain and stress even more, right? Because you can't hide or suppress things forever. they'll eventually come back, and they'll come back worse than ever.
Yeah. I mean, you're talking like I talk to my clients, like toolbox and tools in the toolbox, and oh my gosh, yeah. I mean, that's exactly what I do. I tell them, like, look, we're going to give you physical tools, but we also need to give you the recognition of like what's happening in your body during these different scenarios, like what is, and I help them with that cycle of like noticing when are they, hey, look, your jaw pain is increasing and also these stressors are happening in your life. Of course, I might not be the person to necessarily help them with those things, but at least like helping them pair up, like these are the physical symptoms that you are seeing from your stress. And like also the way that maybe you're winding down at night, right, with scrolling or television or whatever, isn't helping the cycle, right? Like you're saying, partaking in behaviors that aren't necessarily helpful to the cycle. One of them hugely is, screen time, and just spending a ton of time on phones is not
not good. It's not healthy. No, because people need to understand it's the energy that we observe will eventually be the energy that we absorb. And so we have to be really mindful about what we're seeing, what we're listening to, because those things have a similar effect of like when you're trying to eat something and it's bad for you. Well, when you're seeing something, it can be just as bad for you. And it doesn't necessarily come out to you consciously, but a lot of times it will come through subconsciously. If you wake up in the morning, at that time, your cortisol levels are high, your adrenaline levels are high. So I try to recommend to people, do not look at social media or TV for about 2 hours until your body has re-regulated those hormones, because you need those hormones to wake up. But if you start adding things like social media to the mix and you start seeing all these hateful messages, fear-mongering that's going on that, it'll trigger your brain to get into a fight or flight mode. You'll end up getting a little stressed. And it might not be visible to you at the moment, but then it stays in your subconscious, and then later on in the day, something will happen and it will trigger you. And it's because of something you saw earlier this morning that threw you off balance just a little bit. So it's important for us to really be cognizant of the energies that we are absorbing and having power over that, and setting a routine like, hey, okay, you know what? I'm going to spend some time on social media today, but I'm going to do it at this time when I'm in a relaxed state of being, maybe in the afternoon or the evening time when I have some time to myself, instead of doing it as just it's basically it's a quick reaction now. Like, bam, I'm just going to get on my social media. It's such a habit thing, and I still struggle with it. It's just because it's something that, again, it's an addiction that gets created, and you don't even realize you're addicted to it until like it becomes overwhelming to you.
Yeah, 100%. I think it's even, I don't know, I feel like it's hard for me because my business, a lot of it is run on social media. And I think that's like it's been a hard boundary for me to set over the last, I don't know, I've been with my practice for like 3 years now. So that's been a hard boundary for me to set. I've gotten a little better over the years, but it's hard.
Yeah, I agree. So what about what about when people are coming to you and or before they come to you, they're feeling these pain, they're feeling these headaches, but it's almost like an instant reaction for some people to go to the hospital right away. Like as if that is like the innate thing to do. Or let's take a pain medication to kill that pain. Nobody really wants to understand the root cause of what's going on with people's physical ailments these days. They just want it cured as fast as possible. It's like this instant gratification that has consumed us. But nobody wants to spend a little bit of time to figure out, like, hey, do I need to go to the hospital to figure this out? Did something happen to me earlier today that has now triggered this to occur in my body? Because that is the main thing for people to understand, is that our mind, body, and soul are all like interconnected. And if you're in a good state of being and you're aware and you're spending some time in the morning checking in with yourself, checking in with any physical ailments that are going on, you can spend some time putting together why that ailment is happening. Oh, yeah, my knee is paining me. Oh yeah, it's probably because last night I was doing some squats and I went a little too heavy on that. So today I'm going to maybe not work out, maybe put some ice patch on it and go, from there and see how it does. Instead of, oh man, I got to go get this, checked out in the ER right now. I could have, broken something or tore something and I need like an MRI. So how are you working with patients to help them understand, like, when it's an emergency or when you need to spend some time just analyzing this?
Right. So biggest thing is patterns. So I think one is, how long have you been having the symptoms, right? So I educate people. One is like, if your symptoms are not getting better, let's give it 15 days, like 2 weeks. Symptoms are not getting better or getting worse, like then maybe we need to go back to the drawing board. But if like your symptoms are maintaining, staying the same, or getting better, like not an emergent, usually situation, right? I also very rarely do people come to me as like the first line of defense. I am usually the last thing people think about. You're spot on. They go and they take their medication. They go and get their night guards. They go and get their Botox. They go to the emergency room for their headaches and go get an MRI of their brain. And I am the last person that they see. And what we really do work on are exactly what you're saying. We're working on those patterns, identifying those patterns. So then, because once you identify the patterns, then you can understand how to fix the problem, right? So like, okay, you're waking up with more jaw pain in the morning or you have more jaw pain in the afternoon. Those two things mean completely different things to me, right? So waking up with jaw pain in the morning, we know it's a sleeping issue, it's a clenching issue, right? So we're going to be working on that aspect of your care. If it is in the evening, we know that is a strengthening issue, right? Those muscles are becoming fatigued by the end of the day. So we know that that's going to be more of our focus, so it's all like what you said, it's picking up on patterns and then giving the best plan of care based on the patterns that we're noticing, right? Versus just going to the worst case scenario, which unfortunately I think with social media probably puts people in that position to just go worst case scenario.
And this all goes back to regulation of our CNS system, because when we're in this fight or flight mode, we're not paying attention to ourselves. We are always distracted. Our mind isn't, concentrated on one thing. And we're often having our minds in multiple different places. We're thinking about, our work. Then we're thinking about what happened last night with my partner. And then we're thinking about our kids. And then we're thinking about our dogs. And then we're thinking about our family. And, it's just so many things. It's a part of life. But the problem is that we are not taught how to regulate that at a young age, or ever. I had to understand this after I went through a burnout period where my CNS system was overrun and I crashed. And so, I'm very fortunate in that sense that it happened and things turned out the way it did for myself, and being able to be very aware of these techniques and having these toolboxes with me. But for many people, they never get that chance, and sometimes their crash and burn becomes fatal, or they're always in this fight or flight mode, and that gets them down a really wrong path of life, and they're too far gone to be able to turn it around. And so it's really important for those that are listening out there to develop a routine that is focused on being aware of what's going on with you mentally, what's going on with you emotionally, what's going on with you physically and spiritually, and just take a little bit of time, 5-10 minutes in the mornings to just check in with yourself. Wake up and just have a good analysis of hey, am I feeling anxious or stressed today? Okay, well maybe if I am, maybe I need to do something about that. What should I do? Maybe I'll do a little meditation today, a little bit of breath work. Let me let off some of that CO2 that's probably stored up inside of me. Oh, I'm still feeling a little anxious. Maybe I should go for a walk this morning and do something. Take on one task and just feel comfortable doing that one task in the morning. That's going to help us relax. Maybe having some laughter, watching something funny. Things that are going to help increase your vagal tone. And the most important thing to me, I think, is connection. hugging your dog, hugging your cat, hugging your loved one and your kids in the morning, just embracing them. It just makes you feel good and it calms you down just a little bit. And then, take on that next role of, all right, I can now attack the day because I've, gotten some CNS regulation done. And now I can move forward with a better foundation to attack the day.
Yeah, totally.
Yeah. So, kind of just, kind of wrapping up, what are some suggestions, any final tips that you would, recommend, your patients or people that are dealing with a lot of pain, especially, I'm not sure what the exact stat is. I know I deal with a lot of neck pain that I go see like a chiropractor for, but in the past, I would just mask that pain with pain medications, and it would actually lead to worsening of my symptoms. But what are your guidelines that you give your patients in order to have like a very sustained, healthy, an emotional and physical well-being?
Yeah, I mean, the first thing is try and tune in with yourself, right? Try and pick up what patterns are happening in your body, right? Because I think when you know the patterns, then you're able to act more specifically to what's going on, right? The other thing too is just listen to yourself. Like, you want all these other providers to listen to you, and I'm here for it because I love listening to my patients, but you need to listen to yourself. Like, so many times people are like, oh, my pain flared up because my in-laws came in, or, my pain flared up because my kids were acting out. And I'm like, just listen to yourself. Like, just say like, hey, I'm not comfortable in this situation, or, stand up for yourself. And like you said, that's something that I think our generation just didn't really have a lot of guidance on. So that's another thing. Then also start with like the bare minimum. Like, don't go like, oh my gosh, I have to have jaw surgery, or oh my gosh, I have to go to get an MRI, or I have to have a neck surgery. Start with just basic exercise, movement, learning tools to put in your toolbox in terms of exercises that strengthen, and then you can kind of build up from there. So often I see people have like worked top down versus bottom up, and so much can happen when you just work bottom up. So it'd be like those three things, right? Pick up on the patterns, listen to yourself, work bottom up.
Love it. I love it. Yeah. Just, it's all about awareness, and taking some time to yourself, and, focusing on improving yourself slowly. This whole personal growth and CNS regulation, it's a journey. There's going to be setbacks along the way, but it is such an empowering journey, and it'll allow you to live a more conscious and fulfilling life, because you're in control. You're not just surviving, you're going to be thriving, and that's like the most important thing. Just want to thank you so much today, Dr. Liana. We'll have more information about her clinic, and how you can get with her down in the comments below. But until next time, peace.